Audio recording for this meeting has begun.
All right, I think we'll go ahead and get started. Just a couple of things. We want to thank you for joining us today for part one of a three-part series on implementing culturally and linguistically appropriate service standards, otherwise known as CLASy standards. If you could please take a moment and make sure that you mute your telephone, that would be great. If you have any questions, please type those into the chat box as they arrive. Following the webinar, we will send out an evaluation to everyone that's here on the line. It will give you an opportunity to ask any questions that you may not have been able to ask during the webinar. Please take just a couple of minutes to fill out this short survey, this short evaluation, as it really helps the Primary Care Association. A little bit about today. This series was created to provide concrete strategies to improve the quality of health services, reduce health disparities, and advance health equity by focusing on the enhanced 15 CLASy standards created in 2013. In addition, this webinar series places emphasis on the standards that are required by health organizations receiving federal funds to maintain compliance with the Title VI of the Civil Rights Act. Our presenter today is Alicia Gonzalez from the National Center for Farm Worker Health. Alicia's extensive work with the social determinants of health and knowledge of the CLASy standards supports the vision of the National Center for Farm Worker Health to eliminate barriers to health care and increase access to farm worker families to culturally appropriate quality health care. With that, I'm going to go ahead and turn things over to Alicia.
Thank you so much. I hope everyone can hear me clearly. If not, please, Kathy, let me know if I'm not coming through clearly. Thank you so much for being part of today's webinar. I'm really excited to have been working with the Wyoming Primary Care Association over quite a few months in trying to design a program for the network of health centers in your area. So I'm really happy to be able to provide this information to you. And as Kathy was mentioning earlier, this is a three-part series, and the intent why we decided to do a three-part was because the CLASy standards there's 15 of them, and we wanted to ensure that we provided an opportunity for you guys on the phone to be able to ask questions. So we're going to break them up and really spend some time talking about some specific strategies. So I'm not sure how much you all know about CLASy on the phone today, but I really want to help you just break it down and understand it in a very easy to implement way. I have been working with CLASy and working around the areas of cultural competency and health literacy for over 20 years. These topics are really true and dear to my heart. I really love to talk with others about CLASy. I've been working with health centers primarily over the last 21 years and helping health centers implement culturally appropriate services and providing training to staff. So the intent, as you go through the three-part webinar series, we hope you attend the annual training that Wyoming is putting together, and we're going to provide some additional training to support these three webinars. So we hope you make each Wednesday. We're going to be together the next couple of Wednesdays at the same time going through the three-part webinar series with the training that will be following in May. So again, welcome, and we're going to go ahead and get started. You will definitely have an opportunity to ask questions anytime throughout the training. If we don't get through all of them, I will definitely follow up with you via email following the webinar. But we will have I will be posing a question early on in the presentation that I would love for you to share a response via the chat feature, and just to kind of get us started with the conversation. But again, I'm with the National Center for Farm Worker Health, and I'm in Texas, and I invite you to visit our website because we do have a lot of resources available, not only for farm worker patients or families, but also for diverse patient populations that you serve, especially Spanish-speaking patients. So we've developed a lot of different low literacy pamphlets, information sheets, digital stories that I hope that you will access following the webinar. So here we have the 3 parts. Today, I'm really going to be focusing on standards 1 through 4. As I mentioned, there are 15. So today we're going to be talking about governance, leadership, and workforce. What does that mean for you in practice? Then we're going to go into communication and language assistance. And then lastly, on the last webinar, we'll talk about, how do we ensure that we're accountable and that we're constantly improving the systems that we have in place. So this is just in a nutshell what we're going to be doing in the 3 parts. These are the learning objectives for the whole series. Again, it is my goal to really help you understand what the standards mean, what are these practical things that we can do, why should we have an implementation plan, and why it's important to integrate a formal training plan for not only staff, but also for boards and leaders. So this is what we're going to be doing over the 3. Today, like I mentioned, we're going to go through standards 1 through 4. So we had submitted, well, first of all, there was an email that was sent out as a reminder of this webinar that we attached a self-assessment tool. So that's one document that was sent to you, and I hope everyone had a chance to download it and perhaps complete it. I know I got a couple of emails. I got a couple of assessments that were already sent my way. And also on the platform here today, you're going to see a few more documents. One is not only the tool, but I've created an information sheet for you that has all of the standards on it with what do they mean, and then some examples of strategies. So I wanted you to have that beforehand. Again, we're only going through the first 4 today, but you'll have it, and it's a resource for you. And I would want you to bring it to each of the webinars. And then lastly, there is an implementation plan, and it's blank, and it goes by each standard. And it's blank because the intent here as we go through the series is that you can start filling in information as we go. I will say I am pretty confident that all of you who are working in health centers are implementing CLASy. I'm without a doubt. I think that you do, that's the mission, it's integrated into the mission, into the work you do. But through this implementation plan, it helps you document that effort. And it helps you to be able to really look at what you're doing, or perhaps we're not doing enough, or perhaps we can improve upon that. So I want you to have that tool handy so that you can kind of fill it in as we go. And perhaps you didn't realize you were already implementing something and you can take credit for it. And this plan really, at the end of the day, is to help you in your efforts to apply for funding. As you may know, a lot of funding opportunities that are out there will ask if you have some sort of plan to serve your diverse patient populations, and this will only help you to be able to do that. So on the slide here, you see assessing needs, where are you at in achieving CLASy. I wanted to just point out that tool. It's the self-assessment tool that you received about a week ago. And we will not go through it today, but I wanted to just encourage you, if you haven't filled it out, to fill it out following the webinar. Just kind of, it's to see where you're at. What are you currently doing? And then it helps to guide you to then creating a simple, realistic, doable plan that you can do within your health center. And so I wanted to share that with you and hope that you have assessed your current practices. So I just want to point that out to you. So what is CLASy? In a nutshell, It's about, are you providing respectful and responsive care to the patients that you serve? We know that you are serving, changing, your populations are changing. They're becoming more diverse, and they constantly change. I know as I work with migrant health centers, we're seeing a lot of change in the demographics with our migratory patients. We're seeing more males as opposed to females. We're seeing farm workers from indigenous countries. So to what extent are we aware of the changes in our population? Okay, and are we being responsive to that? And so, and this comes in many forms. I mean, you know, are we providing the customer service in the right way? Are we providing the service in the language that's preferred? Is it understood? Is it written in the right way? You know, how are our interactions? Are we using the right terminology so our patients can understand it? So all of these things make up this whole issue that we're going to be discussing today. So I ask you to also think about, in the care that you provide, are you taking into account all the cultural beliefs, preferred languages, health literacy, communication needs? And what is it that you do? CLAS will help you make your services more effective and equitable and respectful. So if anyone were to ask you, what's CLAS, this is exactly what it is. Are we providing respectful and responsive care and meeting the needs of all of our patients? I just want to point to this resource. I highly encourage you to go to thinkculturalhealth.hhs.gov. It's a wonderful resource, and they will provide you with a blueprint on how you can do this, basically. And so what I've done is condensed pretty much all of that information to be able to provide it in a more simple way. So a little bit of background about the history of CLAS. Why did this all, become, it started way back in 2000. These standards were formed. There were 14 by HHS, and it was really a way to help health centers be able to integrate this into the work that they're doing. It's really about providing meaningful access to care to your limited English proficiency clients. Okay, there's an executive order that was placed in line with the Civil Rights Act of 1964 that really requires federal agencies or agencies that are receiving federal dollars to have this in place so that you're providing that access to care, meaningful access to care. And so again, these standards are really here for the purpose of supporting the work that you're already doing. As I mentioned earlier, I have no doubt that you're doing a lot of this work, but these standards are in place to help you do the work. Now, there are just a little bit more to know. Some state agencies have really embraced CLAS, where they've actually passed legislation. Perhaps they passed legislation where all healthcare organizations need to provide cultural competency training to their staff. So we're seeing a lot more states that are actually passing legislation in some way or form to make sure that this is integrated into the healthcare workforce. So just kind of just additional information to know. But now we're going to be talking about what we call the enhanced CLAS standards. Okay, so what they did, they had committees that came together, and they were, after that the standards were implemented, let's take a look at them. How are they working? Do they achieve what we want them to achieve? And then they've made some modifications to them in 2013, and this is what you see, which are the enhanced standards, which I will be discussing in more detail today. And so, I have a slide on making the case. I think we can pretty much all say why this is important to do. Not only is it that we should be doing it to provide meaningful access, as I just mentioned earlier, but health disparities exist. You know that they exist. So as healthcare providers, are we understanding the social determinants of health, and how are we trying to eliminate those in our practices? Do we have referral mechanisms in place where we can refer our patients to be able to address those social determinants of health? What are those patient factors? What's going on in the environment that prevents our patients from accessing care? And what are some provider factors? What do we need to be doing institutionally or internally to address and understand the health disparity. So it takes all of us working together, which is why the standards are designed the way that they're designed. The bottom line is we have all of these things that are working together to be able to help us provide this coordinated care and utilizing the CLASy standards. So for example, for those of you who may have already gone through PCMH recognition, or perhaps you're in the process, this information is going to be helpful. You're going to see a lot of commonalities and a lot of overlap between PCMH and CLASy standards, okay? And so, and any other types of accreditation bodies out there, and the triple aim, all these things work together to design our practice and to ensure access to care for the patient population. So I don't want to spend so much time on this. I know you all are informed about health disparities. You know your patient populations best, and you know that, basically all this information is important to provide access. These are the benefits of doing it. I think that where health centers are challenged is like they don't have a one place where they can actually demonstrate, oh, you know what, here, this is how we're implementing CLASy, and that was the intent today, is that you're able to feel confident that you have a plan and you're working towards improvement, and that you're able to demonstrate, and not only internally and to perhaps the board, but also to your community partners and your funders. That becomes really important. So here's a list of many standards, and I like them all. I think they're all so great. Inclusion, it's all about inclusion and just increasing high quality care to the diverse populations that we're serving. And I also want to note, in addition to Think Cultural Health, that one resource I said that would be helpful for you to navigate and look at, the Maryland Office of Minority Health and Health Disparities, they're another wonderful resource for you if you want to really dig deep into CLASy. Okay, so just some other things here. So these are the 15, and I kind of introduced those earlier to you earlier on, and we're going to go ahead and start exploring these a little further. And you might want to have that little cheat sheet that was part of the the presentation materials today, because this will give you some examples as I walk through them. And so the first standard is all about how do we provide this effective, equitable care. And this standard does not fall into any of the other themes that I'm going to be discussing. This is kind of a standalone standard, and why it is that the intent is when you achieve standard 2 through 15, you're achieving standard 1. So all the things that we're going to be talking about in terms of governance, leadership, and workforce, and the others to follow, are going to help you achieve standard 1. Okay? So again, how do we provide effective, equitable, understandable care that are responsive to the patient populations and language and communication needs? Okay? So here's my first question to you, and I want you to use your chat feature. Again, everything, it's about supporting and improving what you're already doing. What we're going to talk about today, I have no doubt you're not doing it, but I really just want us to think about, really think about it. And so the question I want to ask you here, how do you think, or how, if one idea popped in your head, how are you providing effective, respectful, quality care to your diverse populations? So what is the first thing that kind of comes to your mind? And if you can think of that, and if you can write it in the chat, I would appreciate that. I'm going to give you a couple of, a minute or so to think about it. And Kathy, if you can recite to me some of the responses, that would be great.
I will do that. We've had one come in saying Spanish language / bilingual staff.
Bilingual staff, and what was the first comment?
Spanish language
Okay. And perhaps if you can't think of a response, maybe there's something you've been thinking about that you might want to implement. So what comes to mind when you think of providing effective, respectful, quality care? Did any other responses come through?
Looks like we have one coming in.
Okay. And as a reminder, feel free to make comments or ask questions as we go. Okay, any others?
Another one has come in that says we also take in consideration their education level.
Great. Okay. Okay. Great. All great responses, and these are very very timely because we're going to be talking about how do we prepare staff. Someone mentioned just having bilingual staff. That already is a strategy and how you're being responsive because you're hiring bilingual staff that can speak the language. And so if any more come in, Kathy, please let me know, and because I want to make a note of those.
Okay.
So as we think about these topics, we're going to be talking about cultural competency, linguistic competency, and health literacy. All these things work together. Now, we could add a layer of customer service on top of that and communications because all these things, you know, they all work together. But for purposes of class, these are going to be the complementary concepts that we're going to be thinking about as we move forward. Now, what is cultural competency? We can hear a lot of different terms around it, and you know, we think about it as cultural diversity and awareness and proficiency. This is the definition that they use. It's really about how do all these things work together, our individual attitudes and behaviors, and how they come together in a health center or an organization. And how do we enable everyone to work effectively in cross-cultural situations? That's why training becomes really, really important. And if we don't understand, if we're not doing needs assessments or we're not understanding the populations that we're serving, then it doesn't help us be able to be effective in cross-cultural situations. So I just want to note as a training point here, you know, when we think of cultural competency, people, you know, I hear people say, well, no one's ever going to achieve cultural competence. Well, in a way, that's pretty true. Our populations are changing so much, and it's really hard for us to know every single belief system, value that every patient that comes through your door has, because we're all so different. Okay, culture is so grand and it's so broad, and it works differently from ethnic group to ethnic group. And so, but what it does mean is that we hold a deep respect for differences, and we're eager to learn and willing to accept. If we're eager to learn that, hey, this person is different than I, then that is the step towards cultural competence. It doesn't mean that you have to know everything and know everything about every culture. That's hard. But to be culturally competent, we need to be aware of who we are, who our patients are, and just be willing to accept that, you know what, I really don't agree with what they're saying or why they believe that they have why they got X condition. It's not us to place judgment, but it's to say, okay, I get it, I respect it, and let me help you understand what's going on. And so it's just finding those ways in how we communicate that becomes really key. So as we think about you guys that are going to be doing training or perhaps are interested in training for cultural competency, these are the things that we should be informing staff who are receiving patients that, you know, our patients, it doesn't mean that just because you are of a Hispanic background, and I'll just even go narrow to being a Mexican or a Mexican American, it doesn't mean that all Mexican Americans practice the same style, language, or communication style. It doesn't mean we all have the same health beliefs, family relationships. We can always think, oh, when you think of a Hispanic group, you think of certain things. There's certain characteristics. And as we see our populations changing, that's really not the case anymore. There's so much diversity, religion, and level of acculturation. And I always think about my own personal experience, and I'm Mexican, and you know, just seeing how different my mother is and my grandmother is, and all the different beliefs. And you know, my grandmother practiced real traditional Mexican type healing remedies. You know, we got sick and she had her remedy, and then my mom would only do certain things, and I necessarily don't practice those things. There's some things that I have really held on to, as, you know, because I think it's an important part of my culture. But it doesn't mean that we're all going to behave and think and seek information all the same. So as you think about what do I train my staff on so that they become a little bit more culturally competent, these are things that we need to be thinking about, because there's a lot of diversity amongst the groups. Now, shifting with linguistic, we're going to be talking about class standards in the next webinar around language access. So are we providing interpreter services, which I know that you all are? You know, how are you communicating information? You know, have we looked at our patient forms? Have we looked at our registration forms? Have we looked at our consent forms? Are they written in a way that our patients understand, and that they're not coming to you at the front desk and they're incomplete? And so if they are incomplete, what do we need to do internally to assure that we get the information that we need? So that's a really huge concern for patients in community health centers. So again, there's a lot of information that we're going to impart around linguistic competency. Still, we're on standard 1. It's all about respect. At the end of the day, how do we put respect into practice? And I share this with you, and I hope you can take it and share it with your staff. It's really about how can we make a commitment to pause and looking again. We get so bogged down day to day, and I always think of our frontline workers who are our patient representative staff up in the front. You know, they're managing people, calls, staff who need them for something, and it becomes very challenging. And so sometimes we don't pause and look again, and sometimes our customer service may come out not as positive, or our communications, because we're frustrated as staff, or a lot's going on, but we got to be mindful of how we communicate things and how we say it in a way that's warm and inviting. And this to me is the definition of respect. And it's really, if we look at the breakdown, spec means to look or to see. Re says again, it means again. So we put it together, it means to look again. And so as healthcare providers and in any role in our health center, can we make a commitment instead of maybe judging or maybe making an assumption, because it's very easy to make assumptions, and we have stereotypes and biases as we think about culture and cultural competency. So a real practical definition is just making that commitment to pausing and looking again. Okay, so as you think of number 1, again, I said meeting all of the standards will achieve this principal standard, but these are just questions for discussion. For those of you who are interested in developing a more formal plan, these are the kinds of questions you want to think about with others in your health center and organization. You know, in what ways are we offering respectful, consistent care, taking into account beliefs and culture and language? For those of you who have outreach workers or promotoras de salud or health promoters, there's such a wonderful bridge to really helping health center staff understand what's going on in communities, and that's a strategy. If you have champions, or if you have health promoters that can help inform staff of the diversity that exists in your communities, that's great. You know, do you have a code of ethics around these things, mission, value statements, champions, and so forth. So again, food for thought as we achieve the first standard. I will stop here, and Kathy, are there any questions or comments that came through?
No, nothing's come through yet.
Okay. All right. So let's continue. So now we're going to start going into the theme. So the first theme, today's webinar, is all about governance, leadership, and workforce. So put those thinking caps on. Standard 2. So what are you doing at the leadership and governance part of your organization to promote class? Okay? That's what that one means. So how do we advance and sustain organizational governance and leadership that promotes class? I'm just going to pull out one of my sheets here. Here it is. And health equity through policy, practices, and allocated resources. So in a nutshell, this is all about an infrastructure. What does your infrastructure look like at the board and leader level of the organization? So that's it. Really is about starting, at the top. What do we do to create at the top that then is trickled down to the rest of the staff? Okay, and so this is a framework. This is all about the framework for putting things in practice. Okay, so here are some ideas. So how do I do that? What does that mean? Here are a few strategies to think about. If you don't have any policies or practices or procedures, I encourage you to have that where you're making a commitment to cultural competency. I've seen that quite a bit in health centers where they have, providing culturally competent care, and what does it mean? And they have procedures for staff. Welcome the patient, you smile, you ask what's their preferred language, you ask, so it's just a series of questions to think about so that all of your staff are trained on all of those policies and procedures. Another strategy to think about this is, do you have a recruitment, retention, and promotion plan at all levels of the organization? You want to ensure that you're hiring and bringing on board the right people. Okay? Another strategy, are you providing ways where there's dialogues about language and culture issues during service delivery? So we see that quite a bit with providers. They have ground rounds or lunch meetings or where they're able to present cases together, or again, outreach workers coming to present during staff meetings to inform others about what's going on in the community. Again, it's funneling, it's trying to identify ways that at the top through our policies and practices so that it gets infiltrated throughout the organization. Here's a few more to consider. Perhaps you identify and develop informed and committed champions. Do we make sure that we have allocated resources to be able to implement all of these great ideas? Do we have the fiscal and human resources available to be able to implement some of these practices? Okay, so again, that's standard 2. It's all about strong infrastructure. Another strategy, if you look at your cheat sheet, I've also listed a strategic plan. This is really, really critical. And I've done a lot of strategic planning with health centers, and that is always a strategic direction as part of the strategic plan, is that they're always thinking about ways to providing cultural and linguistically appropriate services. So if you don't have a strategic, I'm sure you have a strategic plan, but if you're not addressing class, this would be a really good way to integrate it within your system. Another strategy for number 2 is creating a class committee. I've worked with a lot of health centers that have really embraced it and recognized that, this has to get done. It's critical to the care that we provide. So they've integrated, or they developed class committees where you have staff from the different service sites that are working together to ensure that they are providing the care to the broad populations that are being served. Okay, so just a few more strategies that I wanted to add in that section. And you'll find as I go through some of these, you're going to be like, well, there's kind of an overlap. And in some regards, There are, but if you refer to that cheat sheet, I've really tried to separate them by key concepts and words to help you as you keep working on this. So the third standard is recruiting, promoting, and supporting a diverse governance, leadership, and workforce. Okay? So the second standard was about the infrastructure. You know, are we addressing class? Now this one is about, are we recruiting folks from the populations that we're serving? Do they reflect and respond to the needs of the diverse service area? Okay, so again, it's about a diverse board and staff. So let's look at some of the strategies here in this section. There's quite a few here. So do we create a work environment that respects and accommodates the cultural diversity of the local workforce? Okay. Do we develop, maintain, and promote continuing education and career development opportunities? Again, this goes to the support. Are we supporting our workforce? Okay. Are we conducting regular assessments of hiring and retention? Are we understanding the demographics? Do we know where we need to be recruiting, basically? Okay. Perhaps there are certain health fairs that you should be targeting, or job fairs where there is a high number of perhaps underserved populations. Okay, so again, really understanding kind of strategically where you can identify potential board of directors who are volunteers, and of course staff. How do we monitor how our staff, and to ensure that everything is manageable and they have the right workload, especially for those who are bilingual staff? Earlier, someone mentioned one of your strategies was having bilingual staff. And what we find in health centers is bilingual staff are wearing multiple hats, right? Because they may be pulled in all of a sudden. If you do not have medical interpreters or trained medical interpreters, bilingual staff are pulled in for translation. So really looking at the workload and ensure that they're not being overloaded. Okay, again, so this is all about staffing and support. Here are a few more. As much as possible, do we assign staff with consideration to whom clients will relate to? You know, I see that happening quite a bit. I'm sure you do that. You might call in someone else who might be able to understand the issue a little bit better. Are we advertising our jobs in culturally relevant publications and websites? Do we consider hiring previous clients as staff members, or maybe consider internships, or maybe past clients can be part of like focus groups and advisory groups? Okay, so that is standard 3. Here's some more here. Are we sponsoring an open house to attract prospective folks from our community? Are we establishing relationships with schools and training programs? Here I see this quite a bit. I know I've worked with a lot of health centers who have worked with universities that have medical interpreter training, and so they have worked collaboratively with health centers to streamline medical interpreter trainings for their staff. So to what extent do we utilize our local resources to support our staff in their work? Okay, so just a few there around standard 3. Okay, the last standard in this area is around education and training our governance and leadership. Okay, so the second standard was, do we have the infrastructure? The third standard was, okay, are we recruiting and supporting the right staff? But then this standard has to do with training. To what extent are we educating all levels, not only staff, but our board of directors should be receiving training as well, our leaders, and of course our staff. And it supports those policies and procedures that we put in place on standard 2. So this kind of all works together in a nutshell. So here are some strategies to think about. So are we taking advantage of our internal and external resources available to educate the board? And so Do you take advantage of people who are experts in these topics to come and share? Perhaps you have champions in your health center who have been doing this work and they know their communities best. To what extent are we using our internal staff to provide that education and training? And that should be done on a consistent basis, okay? And so here having a training plan is a strategy. So I work with a lot of health centers that have a new orientation training plan. I hope all of you on the phone do. And if you do, go in there and make sure that you provide training around class. Maybe you do an annual cultural competency training. Maybe you're giving medical interpreter training. All of these things, maybe it's customer service, it's communication. All of these things make up having this strong workforce, okay, to provide quality care, okay? So to what extent do we incorporate all these training elements into staff evaluations, okay? So we can't expect to just provide training and not see anything in practice. So I encourage you to think about to what extent is this information integrated into job descriptions and performance evaluations. That ensures that we're implementing our policies and practices the way that they were intended to be implemented. How do we encourage staff to volunteer in the community and learn about community members and other cultures? Again, there's different ways you can do that. Perhaps you do that on your own time, volunteering, but do we invite others from the community to come in and provide some sort of presentation, or perhaps, again, the community health workers serve as that link for all staff? And so, again, all these have to do with training and conferences. Do we have budget and resources available for staff to receive training? I know it's hard if you're a health center with 200, 300 employees, but we have to be creative in how we can provide training. And I encourage you to at least provide an annual training on cultural competency, health literacy, to meet that need. That would be meeting this standard. Okay? So here are steps to effective class training. For those of you who may not be, I did receive an assessment from someone yesterday, in fact, that said they're not doing any of this training. And so I would love to work with you, work with this health center more, but I can definitely help you in trying to develop and design a training where you're doing this, and it has to start at the top. How do you engage leadership? How do we also train board and get board of directors involved? And you know, a lot of the board of directors come from the communities that are being served. So what a wonderful way for them to contribute into the process. How do we assess our class activities? That's why I gave you that assessment tool. That's one way, and you're already a step ahead of the game, is really looking at your current activities and what are we doing and what can we be doing better. And so how do we deliver these training modules? For those of you who may be interested in doing more of this type of training, I'm a resource to you. You can always reach out to me, and I'd be happy to share with you some training opportunities as well, because we provide that training here as well. And so for those of you who are going to be participating on all the three parts of the webinar, we hope you attend the May conference, because at that conference we will be doing some more of this hands-on training around cultural competency. So we hope you can make it. So starting point for culturally competent training, here are just some things to think about. You know, we need to let staff know what class is, and again, it is required for organizations that receive federal funding to really use these guidelines to support the work that you're currently doing. So they need to understand class, cultural competency, health literacy. Cultural competency, it will always be a priority area for all of our federal partners, for all folks that you might be applying funding for. So the most that we can, you know, the better we can equip our staff, the better. Again, I really encourage you to do this yearly if you haven't. Health literacy, to what extent are we training staff on how to pick up on the clues or cues that your patients are struggling. If you see them in the waiting room and they have a clipboard of forms and they're taking a long time to fill them out, or they bring them to you, not filled out, what do we do? What are the steps involved in that? But are we training staff on what the clues and the cues are and how to approach the topic? Because there's a lot of embarrassment and shame around, not being able to read. And so we don't want our patients to feel embarrassed. And so how do we create that shame-free environment? And that should be the foundation of the training that you provide on any of these topics. How do we resolve conflicts and respect differences, not only with our patients, but also internally? We have staff of diverse cultural backgrounds and health beliefs and just belief systems. So how do we create a team environment where we resolve conflicts that may arise and respect differences? So here's just a list of some topics to think about. Are we training staff on our cross-cultural communication skills? What are those things that we need to be thinking about? And it's really important. I don't think we always recognize what our bodies are doing when we communicate, or perhaps you're frowning and really don't know it, or you're not smiling as much. And so, and sometimes we just don't recognize that on our own unless someone points it out. So to what extent are we doing some of that training and that role playing so that we're really there about improving our skills? Because unless someone points it out, we necessarily may not know that we're speaking or demonstrating a certain action or behavior. Okay, so I'm going to stop now because I went through the first theme, which covered the first, the standard 2, 3, and 4. Again, all around governance, leadership, and workforce. I love to open it up for conversation. Perhaps you have a question, or if you want to just let me know if you feel that if you're achieving all these, or perhaps you're not sure. So any comments you can bring to the chat feature, I'd love to hear them.
Alicia, we did have another comment come in from
Okay.
Claudia while you were presenting, and she said that patients as board members, advisory groups made up of patients that give input directly to the executive director, and recruiting for outreach staff from among patients.
Yes, very good comment there. Another source of providing information. Patients are board members. A lot of health centers are required to have their consumers on the board, and advisory groups that really are there to provide input. So that's a very good strategy that was mentioned. Anybody else have a thought or a comment? How are you feeling about this first theme? Do you feel like you're doing it? Do you feel like there might be something that you could improve upon? Just any thoughts?
If you have any questions or comments for Alicia, please make sure to type them into the chat box.
And I encourage you to, again, if you did not have these resources available or downloaded or printed out prior to this conversation, again, the plan was intended that even following the webinar, you can go in now to each of the standard. Before we forget, you might go back to your day-to-day and get really busy and not recall as much, but I would really encourage you to take some time and just look at how are you currently meeting that standard, and if it's not being met, then what are some things that you could implement based on some of the strategies I shared with you before. And of course you might want to assign, when you'd like to accomplish that and who should do it. So that was the purpose of the implementation plan. And I will definitely still be taking self-assessment tools if you want to complete them and send them to me. I'd love to follow up with you individually to, offer any support to you that you may need. Perhaps it's a resource, and I'd be happy to do that. So we are 10 minutes shy here of the presentation. If there are no other questions, then I would just like to just remind you that next Wednesday we have the next webinar on April 11th, the same time. Again, I want you to bring your needs assessment. Send it to me beforehand if you can, and we will be tackling the second part, which we're going to be talking all about communication and language assistance. So again, interpreter services, we're going to be addressing health literacy, written communications, verbal communications will be the second part. So if there are no other questions or comments, then we can go ahead and end today's webinar unless something else came in, Kathy.
Nothing else came in, but just a quick reminder that this webinar was recorded and it will be up on the WYPCA website next week. I will email everybody that's on this call and let them know that it has been uploaded, and you'll be able to find that at www.wypca.org. But again, I'll let everybody that's on the call know. And
Great.
Thank you for joining today.
Thank you.
Thanks, Alicia.
Thank you.